around 1 in 10 people suffer at least one moderate to severe symptoms after the COVID virus has left the body. For some people, coronavirus can cause a symptom that lasts weeks or months after the infection have gone. How long it takes to recover from COVID-19 is different from person to person. Many people feel better in few days or weeks, and most will make a full recovery within 12 weeks. But if the symptoms are seen for 4 to 12 weeks, it is called ongoing symptomatic COVID. But if symptoms are seen more than 12 weeks, it is called post-COVID syndrome. In this video, we will discuss some of the common symptoms of post-COVID syndrome. I am Dr. Arijit Banerjee and welcome to another video from channel Health for All. So stay tuned with us. You can see that I am wearing mask while shooting this video. So I request to everyone wear mask to prevent COVID-19 infection. Symptoms are not limited to those with mild infection or those with co-morbidities. The young and healthy too are experiencing post-COVID symptoms. Some common symptoms are persistent cough, shortness of breath, persistent fever, extreme tiredness or chronic fatigue syndrome, chest pain or tightness, problem with memory and concentration, and in common term you call it brain fog, difficulty in sleeping, that is insomnia, heart palpitation, dizziness, joint pains, depression, anxiety, and many more. In the next phase, we will discuss some important post-COVID symptoms elaborately. Cough is one of the most common presenting symptoms of post-COVID infection. Lingering cough could be a residual sign of upper respiratory inflammation. Scientists found that cough might result from the stimulation of vagal sensory neurons of brain caused by SARS-CoV-2 or an inflammatory response or both, leading to hypersensitivity of the cough pathway. Along with this, it might be a reflex of the body to expel the fibrotic damage to the lung parenchyma or damage of the airways caused by the COVID infection. A low-grade fever with malaise, fever around 99 to 99.6 degree Fahrenheit may last a few weeks. It mostly happens as a response from the immune system, and it could be due to the inflammatory pathology triggered by the virus. Generally, no medication is required, but if you are experiencing high temperature rise and chills along with increased BP and pulse, consult with your doctor immediately and check for inflammatory markers and rule out for any secondary infection. Another very common is post-COVID shortness of breath. Breathlessness can occur for a lot of reasons, but it can often make people scared, anxious, or start to panic and may limit our daily activities. The feeling of shortness of breath may continue for a while after your illness. This is normal part of the recovery process. When you experience a sudden rise of breathlessness, even at rest, consult with your doctor immediately. Along with this, palpitation, dizziness, change in heart rate could also be possible, and in that case, you should consult with your doctor as early as possible. The breathing control technique is aimed to normalize breathing patterns and increase the efficiency of the respiratory muscles, and it can be helpful in that time. Muscle joint pain usually lasts for 2 to 4 weeks, but in few instances, it may persist for few months. The joint pain seen in post-COVID patients indicates an autoimmune attack of the joints. The SARS-CoV-2 virus in some cases tricks our body or our immune system in such a way that it remains in the attacking mode, that is autoimmune response, even after the patient has recovered and there is no active infection. This leads to what we call that post-COVID inflammatory arthritis. A good nutritional diet along with plenty of fluids, juices, vitamins, etc. might help. One should properly hydrate themselves and see that electrolytes are properly maintained. Sodium, potassium and other such micronutrients should be balanced with proper nutrition to the body. The profound and prolonged nature of fatigue in some post-acute COVID-19 patients shares features with the chronic fatigue syndrome. Along with other age group young adults who survived COVID-19, even the mild infection are at increased risk of a serious post-COVID chronic fatigue syndrome. Scientists and researchers have found that it happens mostly due to our body's immune response to the initial infection, where in some cases level of cytokines fail to return to its normal level. And another reason for post-viral fatigue may include inflammation of the nervous tissue. In both the cases, it is better to limit your activity, take proper rest, and should not strain yourself. That is how you can manage your post-COVID fatigue syndrome. It is quite common nowadays after COVID-19 that effects of COVID treatment and hospitalization can also include post-intensive care syndrome or PICS, which include post-traumatic stress disorder, sleeping disorder with insomnia, concentration and memory impairment. It has been found that along with the medication, a good diet, mild exercise like yoga and pranayama, and sleep hygiene, music therapy may help, and after some time it resolves spontaneously. Now, when we talk about some warning signs, we have to remember that there are some warning signs after post-COVID infection, and if you have any of the symptoms, consult with your nearest doctors immediately. Those are persistent and prolonged high fever for more than 4 days, racing heart rate or tachycardia, extreme palpitation, breathing difficulty when you have uncomfortable sensation in your chest, or you might feel the tightness in the chest, or chest pain, swollen hands and feet, skin discoloration around face or puffiness, swollen eyes, decreased urination. If you found any of the above, then I think you should consult with your nearest doctor as early as possible. Many patients recover spontaneously if slowly with holistic support, rest and symptomatic treatment. There are ways to help and manage post-COVID conditions, and many patients with these symptoms are getting better with time. But if you think that you have a post-COVID conditions or you have a symptoms, talk to your doctor. Home pulse oximetry can be helpful in monitoring breathlessness. Along with medication, you can perform lung exercise to increase your lung capacity. You can do yoga, meditation, pranayama to improve your mental health. One important thing that after recovering from COVID-19, it is neither recommended that you sit at home and gain weight, nor it's recommended that you jump back to your daily hectic life in a sudden way. It's better you should go slow, start with light workout and then scale it up. So that's all for today. Share this information with your close and dear ones, and subscribe this channel and like and comment in this video. Take care.